Hi everyone, welcome to Monday Reading Live. This is me Vandana PS joining you from 𝐻𝐂𝐬𝐧 Academy. So how was your weekend? Okay, so as usual, today we'll be dealing with part B first, then we will move to part A. So first of all, I'll show you a sample question from part B on the screen. Then I'll give you 2 minutes for the preparation. Then we will discuss about part B. So here comes the question. Yes, welcome back. So, how was the question? Okay, so now let's talk about part B first, then we will move to the question. Okay, so yes, hi Abhi, good afternoon. Clarina, Tessie, Gina, yes, good afternoon everyone. So, how was your weekend? Was it all productive? Yes. So, yes, what about part B? Okay, we know that this exam will be 60 minutes. And out of the 60 minutes, you can take almost 15 minutes for part A. And what about the rest of the time? 45 minutes. It's for part B and C. Okay, so part B, we can take almost 10 to 12 minutes. Okay, maximum you can take 12 minutes for the completion of part B. And which includes total 6 questions. Okay, so out of the 6 questions, this will be like multiple choice questions with 3 answer options. Okay, so first of all, read the question very carefully, understand the question, then read the options, then you can read the paragraph, then eliminate, find out your answer. This will be the procedure. Okay, so read the question first. Like, this is the sample question. So I'm reading the question. What does this extract from a handbook tells us about analeptic drugs? Then understand the question. So what is the question? This is an extract from a handbook. It's all about a particular medicine. Okay, so then understand the question. So what category of question is this? Or in which category the question falls under? So what category? This is all about analeptic drugs or a particular medicine. So this question comes under the category, second category. This is a manual. Okay, I can say that this comes under the second category and it is a manual. Okay, which you are reading for the main idea. Okay, main idea. So what are the keywords? Then the second procedure is that you can mark the keyword from the question, maximum 3. Then handbook, analeptic, drugs. So these are my keywords from the question. Okay, likewise you can mark your keywords just to understand the question. Okay, so this is all about analeptic drugs. Then you can read the options first or you can read the paragraph. Otherwise you can read the paragraph, then you can move to the options. Okay, so now I am just reading the options first. Option A, they may be useful for patients who are not fully responsive. So what are the keywords from option A? May I know in the comments? What are your keywords from option A? Okay. Yes, Jinu, Reshma, Lishma, Binsi, Krishna, Ajuma, Ammu, Jodi, Diana, Binsi, Jibi. Good afternoon. Yes. So what are the keywords from these 3 options? Let me know in the comments from option A, B and C. What are your keywords? Okay. So I'm marking keywords from option A. They may be useful for patients who are not fully responsive. My keywords, okay, maybe, then not responsive. So these are my keywords from option A. What about option B? Okay, Tessie, your keywords useful, not responsive. Very good, dear. Okay, Divya, good afternoon. Yes, GB, useful. Okay, Leah, maybe. Okay, very good, excellent. Then what about option B? Okay, injections of these drugs will limit the need for physiotherapy. Okay, so my keywords, injections, then limits, physiotherapy. Okay, what about option C? Care should be taken if they are used over an extended period. So my keywords, care, then over, extended. Okay, so these are my keywords from these 3 options. So likewise, you can mark your keywords from these options. I know that this question is little bit tough. Okay, yes. Hi Shiny. Yes, how are you? Okay, Binsi, extended period. Okay, Lishma, drugs, physiotherapy, injection, limit, physiotherapy. Okay, Tessie. Binsi, injections, limit, physiotherapy. Okay, Danya. Yes. So these are your keywords. Very good. And what about the paragraph? So when you read the paragraph also, you can mark some keywords from the paragraph. Okay. And that will help you to trace your answer. So if it is a manual, then I can say the title itself is important. Okay. So title is very simple, analeptic drugs. Then what is important here? We are reading for the main idea, as I already mentioned. And I can say that first 3 lines are also important. Okay, in a manual and a policy, first 3 lines are also important. So what is mentioned here? Respiratory stimulants or analeptic drugs. So that is the keyword from the question. Then have a limited place in the treatment of ventilatory failure in patients with chronic obstructive pulmonary disease. They are effective only when given by intravenous injection or infusion and have a short duration of action. Okay, so intravenous injection, infusion have a short duration of action. Their use has largely been replaced by ventilatory support. However, occasionally, when ventilatory support is contraindicated and in patients with hypercapnic respiratory failure who are becoming drowsy or comatose, okay, who are becoming drowsy or comatose, respiratory stimulants in short term may arouse patients sufficiently to cooperate and clear their secretion. So, respiratory stimulants in short term or analeptic drugs, respiratory stimulants, which means analeptic drugs, they can short term may arouse, support patients sufficiently to cooperate and clear their secretion. So we can trace to which option? From this lines we can trace to option A. They may be useful for patients who are not fully responsive. Okay. Alright, so what about the second paragraph? Respiratory stimulants can also be harmful in respiratory failure since they stimulate non-respiratory as well as respiratory muscles. Then, so again, respiratory stimulants, which means analeptic drugs, don't forget that. They should only be given under expert supervision in hospital and must be combined with active physiotherapy. So where is it mentioned, the term physiotherapy? It's here in option B. Injections of these drugs will limit the need for physiotherapy. Where is it mentioned? Okay, at present, there is no oral respiratory stimulant available for long-term use in chronic respiratory failure. So what about the last line? No oral respiratory stimulant, or there is no analeptic drug for long-term use. So that you can eliminate which option? Option C can be eliminated because it is contradictory option, or I can say opposite option. And what about option B? Okay, it is not mentioned anywhere in the paragraph. So what is our answer? Our answer is option A. Okay, they may be useful for patients who are not fully responsive, and that is the correct answer. Clear? Okay, so that's all about part B. Okay, any doubts? A lot of answers. Okay, Shiny, thank you so much for your comment. Okay, okay, it is A. Okay, Kochus, it is A. Jinu, it is answer A. Krishna, Ammu, Tessie, Sumin, Leah, Gina, Binsi, Divya, Sneha, it is option A. Excellent. Okay, a lot of participants, and I'm so happy. And you all got the correct answer. Okay, I'm so happy for that. Okay, Sneha. Okay, Sneha, Carmel and Sneha Satyan, yes. Okay, Harishma, it is option A. Very good, excellent. So now we are moving to the next part. So before moving to part A, let me clarify something regarding this, because when you search for or when you look into part B, you didn't find, okay, anything direct. Okay, you will not get a direct answer from part B as well as in part C. Why? Because part B and part C is all about paraphrasing. Okay, so what is paraphrasing? If you have no idea regarding what is paraphrasing, then your answer will be wrong. Okay, so I can say out of these three options, one option will be not mentioned. One option will be contradictory, and you will have one correct answer, and it can change accordingly according to the questions. Okay, then coming back to paraphrasing. So what is paraphrasing? Okay, there will be exactly same meaning, but the sentence structure will be entirely different. Okay, the sentence structure will be entirely different. For example, here answer is option A. So where did you get that answer from? Suppose I'm asking you, okay, where did you get that answer from? Let me know in the comment. Where did you get that answer, option A? They may be useful for patients who are not fully responsive. Where did you get that answer? Okay. Yes. Okay, Shiny, because of paraphrasing. Yes. Okay. So where did you get that answer? Option A. From the paragraph, where is the answer? Option A. Okay, as you know, option B is not mentioned anywhere in the paragraph, as well as option C is contradictory from the last line. It's very clear. But my question is, where is option A? Okay, Tessie, very good. That is from first para. Okay, it is mentioned here. However, from this line, it is paraphrased. Okay, see, this is not a very direct answer. It is paraphrased. Okay, exactly same meaning, but different sentence structure. Clear? So that's all about. Okay, part B. So now we are moving to part A. Yes. So this is another new material. Axenfeld-Rieger syndrome. Okay. Okay, Binsi, this is from the first para. Okay, Ammu, Reshma, Jinu, Kochus, yes. Ashwati, very good, very good. It is however, yes. Okay, first para. Yes, Shiny, it is from the first para. Very good. Okay, so this is the material, Axenfeld-Rieger syndrome. So what about part A? How you're gonna face part A? Any strategies or any clues to clear part A? Do you have any idea how to clear part A? Okay, yes. So part A, which is an important part among these three parts, right? Part A, part B, part C. And you will get 15 minutes for the completion of this particular part. Okay, and out of this 15 minutes, we have to complete, as you know, 20 questions. Okay, 15 minutes, 20 questions. And what about the 20 questions? Is that the same pattern? No. Okay, it is not the same pattern. We have 3 different type of questions. Okay, so 1 to 7 set of questions that can be called what? Match the following questions. Okay, then 8 to 14 set of questions can be called short answer questions, and the rest of the questions, that is 15 to 20, it's called fill in the blanks type of questions. Okay, so that's all about part A questions. Okay, so what do you mean by match the following, short answer, and fill in the blanks? Okay, so what do you mean by that? So match the following, short answer, and even it is fill in the blanks, which means, okay, first of all, you can read each of the texts. Okay, then we have to identify what are the keywords from each of the text. Then we will complete each and every questions. Okay, so that's all about part A questions. Then, what are the keywords? How will you understand that these are the keywords? And you guys know that part is all about locating a particular answer from any one of the texts. So how will you understand that this is an important word? For example, from text A, suppose I'm saying from text A, Axenfeld-Rieger syndrome. Is that an important word from text A? How will you understand? How do you know that? Or I can say genetic disorder. Is that an important word? So what do you mean by an important word from each of the text? How will you understand that? Any idea? Let me know in the comments. I know that you guys will definitely mark important words from each of the text, right? Yes. So how? How do you know that? May I know in the comments? How do you know that? These are the important words. Okay. So we have a set of keywords. Okay. So based on those keywords, you can mark these words. Okay. So first of all, when you take part A, and as you know, we have 4 different texts, A, B, C, D. Okay. And when you read each of the text, understand that, okay, we have to mark certain important keywords from them. For that, first of all, you can mark all the headings. Okay, so what do you mean by all the headings? The titles. Then subheadings. Maybe they will mention the heading, maybe they will not. Okay, it's up to the type of material. Okay, so sometimes they will mention this heading, sometimes they will not. And what about the third point? So heading, subheading, numbers. So whenever you are seeing a particular number, whether it is in the form of a figure or a word, you can mark all the numbers. Okay, then the fourth one, all the names. So when I say all the names, what do you mean by names? Name of a person, name of a disease condition, okay, then name of a particular equipment, instrument, medicine. Okay, so that's all about names. Name of a country, yeah, maybe. Okay, so whatever they've mentioned regarding names, it's important to mark all the names. Then fifth one, what is the fifth one? Okay, signs and symptoms. Sorry, signs and symbols. Not signs and symptoms, signs and symbols. So what do you mean by signs and symbols? It's very clear for you, I know that. It's all about less than, equal to, then symbol, for example, percentage. Okay, so likewise, mark all the signs and symbols. Then sixth one, abbreviations. So what do you mean by abbreviations or acronyms? Okay, short forms. Short forms you can mark when you read each of the text. And what about the seventh one? brackets. So whatever they have put in a bracket, it is very important. And eighth one, so what is the eighth one other than brackets? Italicized and bold letters. Okay, yes Tessie, very good dear. Italicized or bold, yes. Then you can mark all the words that indicate time. Okay, for example, currently, presently, before, early, delay, now. So all the words that relate with time. During, yes, another important word is during. And next one, the words which indicate experiment. So what are the words that can relate with experiment? Okay, clinic, observation, identification, diagnosis, ascertain. And the next important thing is all about, you can mark all the words that are related to research. The word itself, research, researcher. Okay, study, population. So that's all about research. Administration, yes, of course, administration. And the next one, the first sentence of each and every paragraphs, as well as the last sentence of each and every paragraphs. Okay, plus bullet points. So these are the 13 important words that you have to underline. Clear? Okay, any doubts regarding that? The 13 words? If not, I'm moving to the question. Okay, so now let's deal with the question, the first one. So as you can see here, text A is all about Axenfeld-Rieger syndrome. Okay, it's all about this particular syndrome. What is Axenfeld-Rieger syndrome? Plus its prevalence mentioned here, as well as it is a genetic disorder that is mentioned. Okay, it's all about the particular disease condition. Then when you come to text B, that's all about the different types. Okay, 2 groups of this particular syndrome, as well as lot of issues mentioned here, problems. Okay, and in text C, it's all about the diagnosis and treatment, and here is a diagram, as well as in text D, we have a particular diagram. Okay, so that's all about part A. So now we are moving to the first question. Okay, so what is the first question here? So likewise, when what you have done in part B, you can underline the keywords from the question in part A also. Okay, so that's going to help you to identify the question, as well as it will help you to locate your answer very easily within the time. Okay, I know that you guys know that time management is important, right? Okay, so what is the question? Which procedure should be executed if the corneal clarity seems hazy? Okay, so my keywords, procedure, then corneal, then hazy. So from these 3 keywords, I'm going to find out my answer. Okay, so what is your answer? Any idea? First one, let me know in the comments. What is your answer? For question number 1, which procedure should be executed if the corneal clarity seems hazy? Okay. Okay, so which is mentioned in this particular diagram, right? Okay, so what is the method? What is the procedure they are using? It's all about hazy. Okay, procedure, the treatment is mentioned. So my first keyword, second keyword. Then my third is corneal clarity. So my answer should be this. Okay, so which is mentioned here in text C. I don't have to write that answer there, right? So my answer is C. Okay, so my answer should be C. Clear? Then second one, the problems in which gland may lead to delayed growth of children with Axenfeld-Rieger syndrome. So my keywords, problems, then delayed, then children. Okay, so again with these 3 keywords, I'm going to find out my answers. Problems, then delayed, children. Okay, so I have already noticed that problems, issues mentioned in text B, right? So what about text B? Okay, so see what are the problems mentioned here? Issues with with their pituitary gland. Babies born with Axenfeld-Rieger syndrome can sometimes have delayed, my another keyword, okay, growth. They take longer to start growing and developing than most children. So my answer should be B. Clear? Then third one, how do we define the prevalence of Axenfeld-Rieger syndrome? How do we define? So my keywords, define, prevalence, And that is only my keyword from question number 3. Okay, define prevalence. So it's very simple. From text A, we know that there they've mentioned about the prevalence. It affects 1 in every 2 lakh babies. Okay, very good, Tessie. That is from text A. Okay, dear. So our answer is text A. 4th one, how replicates. So there is a small typo in the question. It is not replicates actually, it is duplicates. Okay, it's not replicates, it's duplicates. Okay, got removed from the study group. So my keywords again duplicates, removed, study. So where the study group mentioned? 4th one. So study group, it's not diagnosis and treatment, we know that. So it's all about the study group that is here in text D. Okay, so what is the correct answer? C. That is duplicates removed from the study group. So my answer is from D. Then 5th one, the role of gender and ethnicity in the development of Axenfeld-Rieger syndrome. So my keywords, gender, ethnicity, development. So these 3 are my keywords, gender, ethnicity, development. So what is your answer? 5th one, it's mentioned here in text A. The disorder affects males and females equally and has been observed in patients from various ethnic backgrounds from all over the world. Okay, so our answer is A. And 6th one, when should one consider glaucoma drainage devices? Okay, Shiny, it is from text A. Yes, dear, very good. 5th one. Okay, so what about 5th one? 5th one, yes. Okay, the role of gender, that is from text A. Okay, so 6th one, when should one consider glaucoma drainage devices? Sorry, it's not services, devices. So my keywords, glaucoma drainage devices. Okay, so your answer is again glaucoma drainage devices, which is mentioned here. Okay, so what is the correct answer? Consider glaucoma drainage devices. So every keywords, each and every keywords here. So our answer is again, it is C. So answer should be C. Then 7th one, what are the signs of systemic symptoms? So my keyword signs, systemic symptoms. And I know that symptoms mentioned in text B. Okay, see, systemic symptoms. So direct answer, which is from text B. So answer is from B. Clear? Any doubts regarding any of the questions 1 to 7? Okay, so now we are moving to the next one, question number 8. And as you know, here is an important instruction that you have to keep it in mind. So what is it? You can write it in a word or a short phrase. Sometimes I've seen that majority of the students are writing more than 3 words sometimes. Okay, so if you guys are writing more than 3 words, they will not give you marks. Okay, so maximum 3 words, short phrase, which means maximum 3. Clear? Okay. So 8th one, mutation on which genes are responsible for the development of Axenfeld-Rieger syndrome. So my keywords, mutation, then genes, development. Okay, so these are my keywords from the question. Okay, so 8th one. So what is your answer for the 8th question? 8th one, mutation on which genes are responsible for the development of Axenfeld-Rieger syndrome. So genes mentioned here in text A, as you can see here, mutations in the FOXC1 and PIX2, PITX2, FOXC1. Okay, so very good, Shiny. Yes, it is answer is FOXC1 and PIX2. Okay, so that should be the correct answer. So you can write FOXC1 and PITX2. This should be the correct answer. Clear? So that is from text A. Okay, so the next one, 9th one, how many articles? So we need a number. How many? Always answer to the questions. Okay, if they are asking about when, they need the timing. If they are asking about what, they need a particular thing. So if this here it is how many, which means number. How many articles got excluded due to death availability of English version? So my keywords, how many, excluded, English version. and I'm searching for my keywords, and I know that it is from text D. Okay, so here see 4. My answer is 4. Why it is 4? Excluded for the lack of English version available. Okay, so very good, Tessie. Leah, it is 4. So answer is 4. Then 10th one. What was the previous name of Axenfeld-Rieger syndrome? So what was the previous name? Previous name, which means the older name, right? So my keywords previous name. So from text A, I got that it is Axenfeld anomaly. So my answer is Axenfeld anomaly from text A. So definitely when you read this text, you will get that particular word, Axenfeld anomaly. Okay, that is an older name, previous name for this particular syndrome. Then 11th one. Which management method should be adopted if the intraocular pressure finds mildly elevated, increased? Okay, so which management? See, name of the procedure they needed. Which management? So which management should be adopted if the intraocular? So my keywords, which management, intraocular. Okay, so what is the correct answer here? 11th one. It is all about the procedure, right? So which is in the treatment option. And which is the procedure? See, intraocular pressure, that is my keyword. So if it is mildly elevated, increased, what is the procedure? It is goniotomy. So you have to do, or you have to go for this particular management procedure. Okay, so that is goniotomy, and that is from text C. Okay, Leah, Axenfeld anomaly, yes, it was 10th question, right? Very good. Okay, 12th one. So what is 12th? The type of symptoms that generally affect the eyes of the child. So they need type of symptom. Which type? The name of the type. Symptoms that generally affect eyes, child. Okay, so what is your answer, 12th one? Okay, so 12th one, the symptoms which is mentioned here. Okay, see, symptoms that affect your child's eye. So what is the symptom? Ocular symptoms. Okay, so do you want to write ocular symptoms or it is ocular? What is the correct answer here? Any idea? Okay, so that should be ocular. Okay, Ammu, Tessie, Anu, Sharmi, Gina, Jyoti, Leah, Shiny, it is ocular. Okay, Sneha, it is ocular. Yes, Anu, your answer is correct. Ocular should be the correct answer. Don't write symptoms because already it is mentioned in the question. See? Okay. Then 13th one. What nature of visual acuity will make someone to go for DLCP? What nature of acuity? What nature of acuity? Okay, again it is a procedure, right? So what nature of acuity? See, multiple trabeculotomy, visual acuity. It is non-ambulatory when you go for DLCP. So that is my keyword. Okay, so I got my answer from here. Answer is non-ambulatory. Okay, from text C. Okay, very good, Shiny. Non-ambulatory, and it is a hyphenated word. Don't forget to write the hyphen also. Okay, Tessie, it is non-ambulatory. Okay, then 14th one. The clear part of the front of the eye. Okay, Leah, Ashruti, Ammu, yes, it is non-ambulatory. Very good. Then the clear part of the front of the eye that gets affected due to the ocular symptoms of Axenfeld-Rieger syndrome. The clear part at the front of the eye. So what is the name of the clear part at the front of the eye? Okay. What is your answer? 14th one. And that should be from text B. Okay, see, issues with cornea. So what is cornea? The clear part of the front of your eye. Okay, so that should be cornea. Yes. Okay, so my answer is cornea. Okay, Shruti. Okay, so what is your answer? Is that cornea? Yes. Okay. Okay, Binila, non-ambulatory, that is for 13th one, right? Yes. Okay, so that's all about short answer questions. So now we are moving to 15 to 20, which are fill in the blanks. You can write it in a word or a short phrase, okay, which means maximum 3. First one, combined trabeculectomy and trabeculectomy should be done if the dash are not visible, if the what are not visible. Okay, if the what is not visible, it is again that those words mentioned here. Okay, so answer should be, what is the correct answer? See, answer is angle structures. Very good, Anu. Answer is angle structures. Yes, angle structures should be the correct answer. Okay, so if it is clear, then you can go for a angle structures visible. Angle structures. Okay, so that should be the correct answer. Okay, then 16th one. Babies born with Axenfeld-Rieger syndrome can sometimes have delayed growth due to the issues with their dash. With what? Okay, with dash. With what? Okay. Oh, a lot of correct answers. Okay, GB. Sharmi, angle structure. Shiny, Rose Mall. Okay, Leah, angle structures. Very good. What about 16th one? Their dash. Their what? It is related to the baby. Okay, so the last point, see what is mentioned here. Issues with their pituitary gland. Okay, babies, keyword from the question, and Axenfeld-Rieger syndrome, another keyword. So pituitary gland should be the correct answer. Okay, and that should be pituitary gland. 17th one, Axenfeld-Rieger syndrome is a rare dash that affects babies as they grow and develop. Okay, so is a rare dash. Rare what? Okay, so very easy question, which is a rare genetic disorder. From text A, Axenfeld-Rieger syndrome is a rare genetic disorder. So answer is genetic disorder. Then 18th one, along with having hypertolerism and a flattened face shape, Axenfeld-Rieger syndrome can also cause babies to have an unusually broad, prominent brow or dash. Or what? Again, it comes under the types maybe or the symptoms. Okay, and answer should be, okay, so here, so wide set eyes and a flattened face shape, Axenfeld-Rieger syndrome can also cause babies to have an unusually broad, prominent brow or forehead. So answer should be forehead. Okay, so that should be the correct answer. Then 19th one, among the 110 articles got excluded, 6 of them were due to disallowing of dash. Disallowing of what? From the study group, right? Okay, see, original data from text D. The last box, it's all about original data. Okay, so original data should be the correct answer. Then the last one, Axenfeld-Rieger syndrome gets passed from the biological parents to their children, and providers define it as a dash condition. What condition? Okay, again from text A, what condition? That means biological parents pass to their children. Providers may refer to it as a congenital condition. Okay, answer should be congenital from text A. Okay, so that should be the correct answer. It is congenital. Okay, so that should be congenital. Okay, so that's all about today's material. So as usual, okay, Kochus, Lishma, okay, Anu, Jeena, Litu, Ashwati, okay, Anu, Reshma, Sharmi, okay, Jibi, Shiny, yes, congenital should be the correct answer. So stay tuned for tomorrow's live session, and God bless you all. Thank you.